Hello, and welcome back to another episode of Straight Up with Steph. Today, we're talking about something that affects every single one of us, which is our skin. If you've ever looked in the mirror and wondered, where did that wrinkle come from? Or why am I getting random acne in places I never got it before? Why is my skin drier than it used to be? Or why do I have this weird crepey skin coming out of nowhere? You're not alone. What's really interesting is the skin tells us the story of what's going on inside our bodies, whether it's hormonal changes, inflammation, stress, aging, sun exposure, all of that impacts our skin. In this episode, we're talking about a lot of the questions that I see being asked online. Like, do we actually need a 10 or 15 step skincare routine? What skin products are actually worth it and what are just hype? Why do so many women in midlife start to get this weird hormonal acne? Maybe they develop melasma. Some people start getting crepey skin or super itchy skin. Like I've heard from some of my followers that they wake up at 2 a.m. with super itchy ears and they cannot sleep. And what's the deal with some of these trending things that we're seeing, like topical estrogen on the skin or red light masks? We also talk about one product that dermatologists say pretty much everyone should be using. What treatments can help things like sagging skin or these jowls that we start to develop, or even the weird neck changes that happen, and how to keep our skincare routines simple and manageable. That's what I'm all about. To help break down all of this, I'm interviewing Dr. Corinne Erickson. She's a board certified dermatologist and a Menopause Society certified practitioner that really focuses on this intersection between hormonal changes like perimenopause and menopause and skin health. She's also the host of her own podcast called The Skin Pause. Highly recommend. I've binged her content in prep for this episode. She talks about navigating skin changes and some other hormonal changes that all of us women are going through or will go through with evidence-based information. This is such a great conversation to learn what you can do to better improve your skin. If you're enjoying the content on this podcast, the best thing you can do for it is to leave a review or shoot me a comment on YouTube. I read everything, and it's things like that that really matter and help this podcast reach more people. And if you know anyone in your life that's also wanting to improve your skin, please share this episode with them. All right, I hope you enjoyed today's conversation with Dr. Corinne. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. Corinne. Welcome to the Straight Up with Steph podcast.
Hello. Thank you so much for having me. I'm looking forward to talking today.
Oh my gosh, I don't know when we set this up. I feel like it's been over a month ago, but I've been looking forward to it ever since.
Oh, me too.
Awesome. So it's funny. So you're in skincare, you're a dermatologist. I'm trained as a hygienist. I'm in dentistry. And a lot of times in dentistry, we say the mouth is like a window to what's going on in the body, which it truly can be. But I would imagine the same is probably for the skin, right? Can that indicate some things that are happening inside?
Absolutely. I have started referring to wrinkles as vital signs because they are not just cosmetic flaws. They are actually communicating a pretty strong message to us about what's happening as we age internally, how our skin is handling external forces and internal forces, and how all of it is shifting.
Oh my gosh, that's interesting. Yeah, I'm excited to a little bit later. I want to talk to you about, skin changes in midlife and perimenopause and stuff. But I'm curious too. So, as a hygienist, when I'm out in public, like at a grocery store or whatever, and someone's talking to me, I can't help it, but I look at their teeth, I start assessing them, and I already have a diagnosis of what's going on, like before the conversation is over. Do you find yourself doing that out in public too?
Yes, and now I'm going to hide my teeth as I talk because you're
No.
going to know that I am a chronic tooth grinder. At the age of 20, I was told I had the mouth of a 40-year-old, and I have some masseter muscles to prove it. Thank you,
Yeah.
medical school and motherhood, I think, for all of that. But absolutely, people often joke that I used to have pool parties as birthday parties, even as a dermatologist, because it gave me an opportunity to sneak up on my friends and make sure they were A, wearing their sunscreen, and B, didn't have any suspicious looking moles all over their bodies. So sometimes the most stressful place for me to be is a public swimming pool where I'm surrounded by mostly naked people looking around and just worrying about them.
Oh my God, it's like overload, right, with skin.
It is. It is.
So speaking of sunscreen, I guess that's a good segue into what I want to talk about. Like, what do you think is the most underrated skincare product that all of us should be using?
It's probably sunscreen, right?
Yeah.
Like it's, all over the shelves at the drugstore. And we all know you're supposed to wear your sunscreen. And some of it's been baking in a golf bag for 3.5 years. And we all own it, but not enough people actually make that important transition of getting it out of the bottle and on to the skin. And so many issues with the skin, from significant medical problems like skin cancer, melanoma, basal cells, squamous cells, and then aesthetic concerns could really be prevented just by the use of regular broad spectrum sunscreen.
How early should someone start using sunscreen on a regular basis?
On a regular basis, well, if your kids are going to school and they're having time outside to play, which most schools incorporate because children need to get the wiggles out and being outdoors is a great place to do it, then putting an SPF on your kids before school is a good habit to get into, even if they're just going to be out for 30 minutes. It's something that I started doing with my kids when they were, you know, 2 years old and
Mm.
heading off to the playground.
What if someone is in their, let's say, I don't know, 60s, 70s, 80s, and they haven't historically worn sunscreen? Like, does it matter at that point, or should they still be using it?
It really does. I think back to medical school and the development of cancer, and that cancer really depends on the right number of hits to your DNA in order for it to form. And so, even if you're in your 60s, 70s, 80s, and you've had this lifetime, decades of sun damage without protection, you still may be able to prevent those additional hits to your DNA, those additional mutations that could be the difference between forming a skin cancer or not. And maybe it's that instead of getting 5 more skin cancers, you only get 2 more skin cancers, but that's still less surgery, less morbidity, and less risk of mortality.
So when we talk about sunscreen, and I'm sure that we could probably do a whole episode just on sunscreen, but are they all the same, or is there one that's maybe better than others?
Great question. So, sunscreens do come in different varieties. There are generally 2 broad categories called your mineral sunscreens or your inorganic sunscreens, physical blockers. That's zinc and titanium. And then you have your chemical sunscreens or your organic sunscreens or chemical blockers. These are more of the avobenzones, octisalate, oxybenzone, octocrylene. I often differentiate it for patients and say, look for 1 or 2 active ingredients and you're in the physical sunscreen zone. Look for 4 or 5 active ingredients, and that's where you're finding yourself in the chemical sunscreen land. And they work in different ways. The chemical sunscreens absorb the UV light and then kind of scatter it, versus the physical blockers that are truly reflecting it and preventing the absorption off the skin. And there's different implications to the body, different concerns and debates around them for the body and for the environment.
It's interesting. So I guess a couple of months ago, I was in the Bahamas with my boyfriend, and I didn't have, all I had was like my little travel size like facial mineral sunscreen, and I needed something for my body. And at the resort, they had a bunch of the chemical sunscreens, and I knew from a podcast, I think it was a Huberman Lab podcast that I listened to a few years ago, and he was saying that mineral was best. They only had one mineral sunscreen. It was a spray one, and they're like, just FYI, it's going to make your skin white. Like, and she was trying to dissuade me from using that. And I was just like, I don't care. And it kind of did, like, it was white, but I still felt safer using that versus one of the chemical ones.
Personally, I like it when the mineral sunscreens, the zincs and titaniums, come out a little bit white, especially when I'm applying it to my children who are like wriggling away from me, because I can
Yeah.
see where I've put it and I know that I have good coverage on it. That isn't for everyone. So, what I tell patients is that the best sunscreen is the one that you're going to use. And
Okay.
if you really do prefer the mist and run approach of an aerosolized clear sunscreen, if that's the best I'm going to get from you, then that's better than nothing. But certainly, I prefer the mineral protections because I like the more reliability of coverage, that you see it going on the skin. You don't have to wait the 20 minutes for it to start to work as you do with the chemical sunscreens, because I don't know, put sunscreen on my kid and tell them to wait 20 minutes before they go out. That's
Yeah, good luck.
impossible.
Yeah.
So I think there's a lot of practical implications. And fortunately, the white cast is getting better with the micronized zinc formulation. So as chemistry and technology improves, those formulations are becoming cosmetically more appealing for patients to put on.
Okay. All right. So sunscreen sounds like it's pretty at the top of the list. What about the opposite? Like, what do you wish people would stop using so much that they think is actually making a difference?
Ooh, I think that generally things that people do to their skin that don't help are more in they're not doing anything with skin health necessarily. I think it's this obsession with clean skincare,
Okay.
interestingly enough. It's trying to avoid any products that have any preservatives in them is really difficult as a dermatologist because preservatives are what keep fungus, bacteria, and viruses at bay from our product selection. So I think there's a fear of products that are formulated that contain preservatives because they're afraid that these chemicals are going to be hormone disruptors or they're going to be carcinogenic in some capacity. And that distrust of science and formulations can lead to fear and resistance to using products that actually have a whole lot more data to how they're preventing and protecting us from cancer than how they're actually causing it.
So, how can someone, just your average person, I guess, differentiate, like, know that something is okay to use versus something that maybe has too much chemicals? Or do they just need to have a dermatologist so that they can ask?
I mean, I think that everybody needs a dermatologist, number
Okay.
one. People generally need a skin exam once a year to check your skin, to have that conversation, to assess the damage that you have. Now, when we decide what we want to put on our bodies and in our bodies, there's science behind it, but there's also personal preferences. And I really do think it's important to honor that. And so, as a dermatologist, I try to remain very well versed in products that check the boxes for people. If I have patients who really want to stay, as clean as possible, then we go with a product that's, zinc with very minimal ingredients, something that's in the like free and clear camp or Cream that's great for babies, that's really safe for people with a lot of skin sensitivities. I think listening to people's concerns about what they're worried about. Are they worried about endocrine disruption? Are they worried about the wreaths? What are your fears? Let's talk about it and then let's find a fit to address it safely for you, keep your skin safe, but also make sure that you're comfortable with the approach that we're taking.
Okay. And what's a skin myth that you wish would just disappear?
Oh, the concept of a base tan being protective. I mean, there's
Oh, okay.
really no credence to that. There is no such thing as a safe tan. Tanning is an expression of DNA damage in the skin. A tan is sun damage. So I wish that that would go away.
Okay. Oh my gosh, that's so funny. Okay, Dr. Corrine, I grew up in Alaska. That's where I was born and raised. And whenever I was getting on a trip or getting ready for a trip to go to Hawaii, we would go to Hawaii a lot to vacation. We would go to tanning salons to get the base tan, right? So that when we got there, we wouldn't burn. So I haven't thought about that in so long. It's really interesting that you brought that up.
Yeah, I live in Georgia and we still see this all the time. Oh, well, I'm just going to go get a quick base tan before my beach vacation. And, truly the best thing is to just don't get burned on the beach to begin with. I think the motivation behind the base tan is a little off as well.
Interesting. It's probably just marketing, right? The older I get, the more I realize so much of this stuff is just marketing.
Oh, so much of it.
Yeah. So when we're talking about at home skincare routines, do we actually need a 10 or 15 step routine every day?
No, and in fact, you're getting kind of diminishing absorption the more and more steps you have. There's only so much space between your skin cells. There's only so much space in the skin to absorb these products. So I am not of the 10 to 15 step camp. I am more of a skin minimalist when it comes to the number of steps. I have my non negotiables that I consider, especially as we get older for women in midlife. Everyone needs to be washing their face. It doesn't need to be with anything fancy or expensive because basically it is going to be on your skin for a short period of time and then it's going to go down the drain. So you need to wash your face with something that gets the job done. In the morning, you need to wear a good topical antioxidant on your skin, something in the vitamin C family, like
Okay.
L-ascorbic acid or THD, are good vitamin C's that are formulated in skincare products to help give your sunscreen extra support for protecting you from UV, but also from pollution and from internal oxidative stress. You need a broad spectrum sunscreen. So you wash, you antioxidant, and you SPF in the morning. And then in the night, you wash your face. I think retinols are really important, and it could be retinol, retinal, retinoic acid, which is in the prescription formulations. There's different precursors if you're sensitive that are good options for you. And then a moisturizer. And, that really breaks it down and it's very manageable. I always tell people you want to keep your teeth, you brush them twice a day, right? You want to keep your skin as healthy as it can be, you take care of it twice a day. And I often tell people to put their skincare next to their toothbrush because that's when nobody forgets to brush their teeth.
Well, I
Well, maybe
mean,
I'm wrong about that. You may have seen differently.
but we can leverage it, right? Like if we know they take care of their skin, I'll recommend they put their toothbrush next to their skincare and you could do vice versa. It's just this habit stacking.
It's habit stacking.
Yeah.
Exactly.
So those are your non-negotiables. What about like eye creams and stuff like that? Are those helpful or are they just kind of optional if we want to use it?
Eye creams are helpful because as we get older and certainly as estrogen starts to fluctuate, we lose thickness of our collagen and we lose hyaluronic acid in our skin. And the places where that's going to manifest first are in the thinner skinned areas. And the two thinner skinned areas are the eye area and the neck. And so many women notice that their eye area and their necks are aging at an accelerated pace compared to the rest of the skin. So if you are starting to experience that, then that is when we do incorporate the conversation of maybe a specific eye product. And the reason that a specific eye product may be more important is because that skin is so much more sensitive and fragile. So having a formulation that's not going to be too potent, that's going to be more hydrating without clogging the oil glands, which could lead to little milia that can pop up, is important.
What's milia?
Milia are tiny little clogged oil glands that get a little almost like kernel of dried keratin and sebum, and they're really
Oh,
hard, tiny white bumps. They look like pimples, but they're hard. They have full coverage of skin, and you can't actually pop them like you can a whitehead. In the office, we have to take a tiny lancet and open them up and express them out. They're very common in the eye area, and excessively heavy moisturizing products, which are tempting to reach for if your eyelids are dry, can promote more milia formation. So a good eye product can be helpful if that's a specific concern that you have.
oh, okay. That's interesting. A while back, I had one of those. It was on, like, right on my eyelid. And I was like messing with it, and it's so sensitive there. But I was just like, I don't
Yeah.
think I can get this out. And so when I went to see my esthetician, she was able to just like get it. It wasn't comfortable, but she was able to get it out. And it was hard. It was like a
Yeah.
pebble. Yeah.
It's like a tiny grain of sand under the skin, and they're very common in the eyelids, and people often try and pop them themselves, and it doesn't work out
They
for
just
them
can't.
very well
Yeah.
at all. Sometimes it doesn't work out well for us as dermatologists because they're on the upper eyelid, and that's just a difficult area.
Yeah, it's tricky. So, what's a product that you see people maybe using a lot at home that is not worth it?
I would say that there's a lot of products in the peptide space that may not have as much data behind them. I think a lot of it is, to your point earlier, marketing. I see a lot of girls in their teens and early 20s who are putting snail mucin on their skin or beef tallow on their skin. And I'm like, we need to go back to kind of the animal, vegetable, and mineral conversation and divide things up. So I think products that have more hype behind them from a marketing standpoint, more TikTok strategy than true skin strategy, something that seems exotic and fun and different. It's mostly, though, mixing too many different types of products than just
Mhm.
choosing one thing that is problematic.
Okay. Does it make you cringe when you see these like get ready with me videos from influencers and they're seriously doing like 10 or 12 things to their skin all in a row? I'm just like, what are you guys doing?
Frankly, it makes me exhausted. I'm like, y'all
Yeah.
are wasting, and I'm like, you are wasting so much money.
Yep.
Stop that. And then I get
Yeah.
upset because they're also then wasting other people's money who are following them. But yeah, it is cringy to see that because there's not science behind those steps. It's,
Yeah.
someone who's usually very attractive, who, girls want to look like and be like and emulate, and it's communicating this message that more is better when really it's the right steps are better. We need to get back to that.
Isn't it funny how when we're talking about things that actually work, it's the stuff that has worked for the last 50 years. It's not the new stuff. Like I've talked to someone, a hair care expert. I had a GI doc on yesterday. I've talked to someone about vision, like keeping our vision healthy, and everything traces back to these really simple things. It's nothing fancy. Same with dental care. It's not the oil pulling. It's not the fancy like things that are out there now. It's brushing and flossing. Like that's it. It's not
Right.
sexy, but that's what works.
Right. And unfortunately, that's boring, right?
I
Like
know it
people want
is.
something new, innovation. But the way to look at that and the way I talk about it with people is there is innovation. It may be that, like we said earlier, all of a sudden your zinc sunscreen is not the thick paste on the nose in the 80s movie, but it's a nice, elegant formulation. For example, hyaluronic acids have come a long way. Well, hyaluronic acid is nothing new, but the formulations now that can incorporate a low molecular weight with a high molecular weight and get penetration without inflammation. Those are fabulous. But new gets more attention. It's more buzzworthy. If I started a skin influencing attempt just talking about sunscreen, I'd probably be followed by, maybe my medical assistant, maybe.
Like your family. Yeah.
Right, just to be nice.
Yeah. So speaking of so I had a trichologist on a few months back, a scalp
Mhm.
health expert,
Yeah.
and she taught me how to wash hair. And I was like, oh my gosh, I've been doing this wrong like my whole life. Is there an actual technique that we should be using when we're washing our face?
When you're washing your face, it's important to really make sure that you're letting the cleanser soak in and degrease and remove its oils. And you just need to pay attention to what your need is in that moment. So there's different even strategies and philosophies around cleansing. You hear about double cleansing. You hear about kind of using your cleanser as a mask. You hear about
Mhm.
oil cleansing. So there's even within the facial cleansing world, we've managed to overcomplicate that. And so generally, I just like to think, first of all, what am I trying to remove from my skin? If we're talking about a full face of makeup and a thicker sunscreen, then yes, I may reach for an oil cleanser first, especially with makeup, because like attracts like. So the oil in the oil cleanser pulls the oil from those makeups I've applied off of the skin. And then, because oil cleansing, if you've ever tried it, kind of leaves you feeling a little bit oily sometimes, then I'll follow it with like an alpha hydroxy acid cleanser that's really working more on my skin surface, where the glycolics can hit that stratum corneum and gently dissolve and remove some of the dull, dead skin cells from the surface.
Okay, interesting. I travel quite a bit. I give like a lot of like lectures and stuff. And I forgot my face wash. And I don't generally like to wear makeup, but I do if I'm on stage. And when I got back to the hotel, all they had was like bar soap. And I was like, okay. And I had a bunch of makeup on, and it was just like it was doing nothing. And then I just took the towel and like wiped my face and it was just covered in makeup. And I'm like, okay, this is not cutting it. So I probably should have used some kind of oil-based cleanser in that situation, right?
Oil based can be really helpful for makeup,
Okay.
or you can just take your CeraVe foaming cleanser. Or when I've been traveling, all I can find sometimes is a generic bottle of Cetaphil. And you may
Mhm.
just need to do a double cleanse with that. But the white towel test is certainly a very good indicator of whether or not you've gotten all of that makeup off.
Yeah, I just felt bad. It was just completely covered in makeup. So I want to talk about some of these skin changes as we age. And when I was younger, I struggled with acne. I had bad acne. And I remember them telling me, they're like, don't worry. This is just when you're young. You're not going to have to deal with this when you're older. Now that I'm older, I'm like, that's complete bullshit because I still get like, I'm broken out right now. It's changed, like, it's not the same as my breakouts when I was younger, but what causes people in their so I'm 43, but what causes people in their 40s and 50s to then start getting acne again, especially the deep ones that really hurt?
Right. So think about where men get facial hair, adult women get acne. And it's
Oh,
because it is androgen hormone mediated. The facial hair in men is mediated by androgens. The facial acne in women, which is very characteristically located along the jawline and the upper neck.
yep,
And my new favorite hell of hormonal acne personally are these like cystic ones in the back of my hairline that drive me crazy.
yep.
So think about where men get facial hair that's hormonally driven, adult women develop acne that's hormonally driven. And it's typically not because there's an abnormality in the hormones, although we do see it more in conditions of androgen excess, like PCOS. You can just see it with heightened sensitivity of the receptors, your
Mm.
androgen receptors in those areas. You can see it with fluctuations of your hormones, which is why we see that more either at ovulation, when generally our androgen levels are higher. And you can see maybe a peak in your libido around the same time that your face is breaking out. Or you could see it right before you menstruate when your estrogen levels are lower, and just relative to that, your androgen levels are higher. So there's different patterns and cyclicality of that breakout. Now, the problem with women and hormonal acne is that they're deep and cystic. So they often show up and they're still kind of there by the time your next cycle hits because
Hmm.
it has such a persistence to it. And they're often deep, inflamed, and not just on the surface that you feel that you can easily manage yourself.
Well, it's like I'm sure you don't recommend like pimple popping or picking, but even if you do, it doesn't do anything because they're just like so deep in there. If anything, it just makes them worse and like
Makes it
more
worse.
inflamed.
It makes it worse. I talk about this a lot with patients because it's like a balloon under the surface that gets filled up and filled up and filled up with sebum. And if you squeeze it and you pop that balloon under the surface, then your immune system, your inflammatory cells are suddenly exposed to the contents of your pilosebaceous unit, your oil gland hair follicle unit, that they're really not supposed to be exposed to. And our
Hmm.
bodies treat that like a foreign body. We launch this big inflammatory reaction to it. So we're trying to get relief on the surface, but really, when we're rupturing it underneath, it really ignites that inflammatory cascade.
So what can we do for those times to make it better? Do we just have to write it out?
So there are some great topical treatments that can actually help with this. One of my favorites has its active ingredient is colloidal sulfur, which is just a nice anti-inflammatory, gentle antimicrobial that you can apply as a spot treatment. Benzoyl peroxide, which is a readily available acne ingredient in many over-the-counter formulations, helps to kill the bacteria that's overly represented. It helps to break up the plug on top of that clogged up oil gland to release things. It calms the inflammation down. Even some of the pimple patches can at times have a role to play, particularly in people who can't keep their fingers off of their breakouts. I do recommend the non-medicated pimple patches, which is basically just a little colloidal bandage. There's somebody was brilliant in calling it a pimple patch. It's a colloidal band-aid.
Okay. What about heat? Does that help? I've used that sometimes if I've got a really nasty one, like putting some heat on it tends to, I don't know, make it go away faster.
Sure, a warm compress can be helpful. It can help
Okay.
just again gently open up the surface of that oil gland like you would if you had a sty on your eyelid.
Yeah.
Any kind of little inflammatory pocket, just to encourage it to drain without manipulating and breaking the skin surface. It's that trauma to the skin surface that can create more issues.
Yeah, for sure. So, with all these changes in midlife, so I hit perimenopause a couple years ago, and it's been an experience. But how do perimenopause and menopause affect the skin and these changes that we start seeing?
Perimenopause and menopause affect the skin in probably five fundamental ways
Okay.
that we talk about. So, what's happening hormonally is that the estrogen levels are really starting to become erratic. And one day they could be sky high, and the next day they could be virtually on the floor. And ultimately, they're going to zero if left to their own devices post menopause. Well, estrogen receptors are very prevalent in every organ of our body, including our skin. And they are present on our keratinocytes, which are the cells that comprise our skin layer. They are present on our fibroblasts, which are responsible for producing collagen, elastin, and hyaluronic acid. They're present on the blood vessels within our skin. They're present on our hair follicles and within our oil glands. So as those levels become erratic, number one, we stop producing as much collagen and we shift, starting at age 20, we shift from collagen gain into collagen loss. And within 5 years of menopause, you lose about 30% of your collagen and then 2% per year after that. So that's estrogen impact on fibroblasts. That is no longer. You also lose the elasticity. So collagen gives skin its structure and support. Elasticity gives it its stretch, which is why we start to sag. We stretch and we don't recoil. So that
Okay.
elasticity loss. The hyaluronic acid loss translates into dehydration, which is why dryness becomes such a complaint, probably one of the earliest complaints I hear about women when they hit perimenopause and menopause. There's more inflammation and redness in the skin due to the impact of estrogen on the blood vessels and also the loss of the anti-inflammatory force of estrogen in the skin. And then finally, there's impaired wound healing. And so we heal slower, we bruise more easily, our skin becomes inflamed and stays inflamed longer. So ultimately, you get dry, you get wrinkles, you get saggy, you get red, and you don't heal as well. And those are changes that may not all show up together, but they do for a lot of women make themselves known pretty seemingly suddenly as those hormone shifts happen.
Yeah, I feel like me personally, I went a long span of time without feeling like I was aging. I just felt like I was cool. And then it was almost overnight. I felt like a different person. I felt like I looked different. My skin was different. I was starting to like sag a little bit. And of course, all the internal changes with menopause. And it felt like that. And it's very, I don't know, disorienting, shocking.
And emotionally upsetting. I
Yes,
think
very.
we're very comfortable in the menopause space talking about this validated concept of not feeling like ourselves.
Yep.
As a woman, for a lot of women, feeling like yourself is looking like yourself. And when you
Yeah.
wake up one day and all of a sudden you don't feel like you recognize the woman staring back at you, but you've been doing all the hard work. You haven't really changed anything. You haven't totally fallen off the self care wagon. That's very unsettling. And it contributes to that feeling of not feeling like ourselves.
I can totally relate to that. Can we talk a little bit about melasma? Because that's something that for me has popped up. I remember seeing it in the mirror and I thought it was dirty. And so I was like, what the hell? And I was just rubbing it. And then I'm like, okay, this isn't dirt. And then I realized it was melasma, which is super frustrating to deal with.
Melasma is super frustrating to deal with for so many women. And it is, while it shows up for many women before perimenopause and menopause, it can become more problematic at those times as well. And yes, it's the dark spot on your skin that you just cannot seem to scrub off, right?
Yeah.
So
Yeah.
melasma is interesting. Melasma is hyperpigmentation of the skin, typically of the face, although it can affect other areas like the neck and the forearm. And it has several different important causes, one of which is sun exposure, one of which is heat, one is hormones, more so estrogen, but also progesterone. There's also a genetic component to it, and then there's an inflammatory component to it.
Mm.
So, a lot of women first experience melasma during pregnancy when estrogen levels are higher, or when they go on a combination oral contraceptive pill, or just from having their own normal levels of estrogen circulating in their bodies. And there are some men who get melasma, by the way, because turns out men have estrogen too.
Hmm.
And so it's multifactorial, and it's not just one thing that's triggering it, which can make it difficult to treat. And unlike a sunspot that we can zap off with a laser or use a lightening cream, melasma is a chronic and progressive pigmentation condition. And even if it was triggered by a birth control pill, going off the birth control pill doesn't make your melasma go away. So it becomes something that we have to develop a long term strategy to address, and we have to set expectations accordingly.
So, what is that strategy? How do you manage it?
So there's a couple of things. If there is something that is triggering it that can be mitigated, we try and mitigate it. For example, going off a combination oral contraceptive pill will not fix the melasma, but it staying on it will make it more difficult potentially to treat and get under control. If someone is doing a lot of hot yoga, for example, and melasma is something that they really want to address, we do talk about changing that behavior somewhat, because not a lot of the things that can provoke melasma aren't bad for you, but they do feed the melasma. So it's a complicated conversation. Sun protection is really important. And I talk a lot about not just addressing the typical UVA and UVB with your broad spectrum sunscreens, but being very conscientious about protecting your skin from visible light. So my melasma patients are also on tinted sunscreens that contain iron oxide, which is an effective visible light protectant.
Okay.
We boost antioxidant protection, sometimes even internally with a supplement that contains a fern extract that gives you some more antioxidant protection. It's called Polypodium leucotomus, or Heliocare is one of the brands in the United States, and then a good topical vitamin C externally. We use a lot of retinoids to help promote better skin cell turnover and lighten and brighten. And then we may need to do some more active melanin blocking agents as well.
Okay. In the past, I've been put on hydroquinone. Is that something that helps?
So hydroquinone, especially when combined with a three-part compound with topical steroid and a retinoid, has been considered the gold standard for melasma treatment for a long time. Now, hydroquinone works because it blocks an enzyme called tyrosinase. Tyrosinase is the step in the enzymatic pathway that leads to melanin production. So hydroquinone is shutting that pathway down. Hydroquinone has some problems with it. It has a PR problem in the United States because
Okay.
it's actually banned in Europe, and it has been for quite a while due to concerns of paradoxical darkening of the skin. And when hydroquinone is used for long periods of time, and when I say long periods of time, the two times I've seen this in 15 years of practice, the patients were both using it for over 20 years. It can cause this almost permanent darkening called exogenous ochronosis. It's horrible and very distressing to patients. So hydroquinone needs to be managed appropriately to be used safely, pulsing it for 3 to 4 months at a time and then taking 3 to 4 months off. There are concerns as well in some circles about its endocrine disruption and potential hormone impact as well. But hydroquinone is effective. I do use it at times in my practice, especially in combination with a steroid and a topical retinoid.
Okay. So if someone has melasma, and I'm grateful mine isn't like severe, but if someone has any kind of melasma, is it realistic to think that if they treat it with whatever you're recommending or hydroquinone or whatever, that they would not have it anymore? Can it be like cured?
I have seen it go away and stay away in a few cases, although usually there is a chronicity to it. And there's always
Oh,
going to be the need to do something, right? So, the most effective treatment with long term results I have seen in my practice is with a medication called oral tranexamic acid. Tranexamic acid is used to control heavy menstrual bleeding. And there was a study, gosh, maybe 8 years ago at this point, showing the impact of oral tranexamic acid on addressing melasma. And I have seen really nice longer term results with this.
mm,
However, There are multiple pathways. And if you get more sun exposure, if something shifts in the hormone space for you, your melasma could come back. So you just need to always be aware that it's a possibility. You also need to be aware that every treatment for hyperpigmentation and dark spots on the skin is not a treatment for melasma. And a lot
Mm.
of the laser and light based procedures that we use for freckles and solar lentigines can actually make melasma worse because of that heat and light exposure. So, not all dark spots have the same dark spot eraser.
Interesting. Okay. So what if someone has melasma, what should they avoid putting on their skin? Or like the reason I'm asking this is like 6 months ago I was learning about red light therapy and I got a red light mask. I used it
Mm,
twice and then I learned that people with melasma shouldn't use it because the heat will make it worse. And I was just like, well shit, I just spent like $300 on this thing. So what should
yeah.
we avoid?
So anything with heat,
Okay.
generally heat and light exposure,
Okay.
including the visible light spectrum, which red light is visible light. So I get asked questions about should I be using a red light mask all the time? It's probably like in the top 3 questions I get asked as a dermatologist. And the only answer to that question I get really excited about is saying if you have melasma, do not use a red light mask
Hmm.
because red light is visible light and just the heat and exposure from that can exacerbate your melasma. Something else I caution women with melasma against doing is the increasing interest in putting estrogen, estradiol, or estriol on the face. I do not recommend that for women who have melasma. Melanocytes in skin impacted by melasma have been shown to have extremely active estrogen receptors, and you do not want to further activate those estrogen receptors and those pigment producing cells if you don't want to have melasma. So I counsel against that. And then really being cautious about anything excessively irritating because inflammation is another pathway by which melasma can worsen. So, not using excessively drying or harsh or irritating skincare products, not trying to give yourself an at home chemical peel with harsh acids to remove it. And these things are tough because some of these products are targeted to help treat hyperpigmentation. But keeping it gentle and taking a slower and more gradual approach will ultimately help in the long run.
Okay. I'm really glad you brought up topical estrogen because that's another thing I just see every time I open my phone. I swear I see. And honestly, I think that's how I found you was a video that you did on because people were asking you if they could put their vaginal estrogen, which I know is very important for the skin down there and preventing this
Right.
what is it, genitourinary syndrome of menopause.
Yeah.
But yeah, so like is it beneficial? Let's set melasma people aside. Is it beneficial to put that on the face?
Yeah. So we talked about the impact of estrogen loss and how estrogen receptors are so prominent in our skin, and our skin is very estrogen receptive. So that has sparked research into whether or not applying estrogen topically to the face can help with things like collagen formation, skin thickness, wrinkle reduction, and hydration. And while we don't have the big, robust clinical trials that people would love to see, we do have data and we do have clinical trials behind estrogen formulations on the face. And they have shown that estradiol in the same percentage and formulation used for vaginal estradiol, 0.01%, which is local, not systemic. That's important. And estriol, which is available in more compounded formulations, can be helpful in reducing wrinkles, improving hydration, and thickening collagen. So it is a promising area of research that people get extremely fired up about.
Why do they get so fired up about it?
Oh, why do they get so fired up about it? Oh, I don't know. I think maybe they're bored, honestly. I like so in dermatology, we do things off label a lot.
Yeah.
Okay. We prescribe spironolactone for hormonal acne. That is off label. Like we use medications off label. I wonder in part if it's because in the OBGYN world, things are not used off label as frequently. Because if you think about it, the stakes are much higher. There's more medical legal considerations. Scientifically, what are people worried about with estrogen on the face? They're worried about something called unopposed estrogen. They're worried about putting estrogen on any part of the body it getting absorbed into the bloodstream and creating proliferation and thickening of the uterine lining. It's called endometrial hyperplasia, and it's a risk factor for endometrial cancer, which is why if you have a uterus and you're on estrogen systemically, you also need to be on a progesterone to
Hmm.
protect your uterus. So, what gets people worked up is that they're concerned that the data is lacking to show that topical facial estrogen will not get absorbed into the bloodstream and potentially cause endometrial hyperplasia. And that is the concern.
Okay.
So, what are we never going to get? I don't think we're ever going to get a study that looks at facial estrogen and then does uterine biopsies. I don't think we're ever going to get that,
Okay.
right? It's a generic topical medication. No one's going to pay for it, and I doubt any woman is going to sign up for it. Nor do I think it's needed. Because if the estrogen can be shown not to be getting into the bloodstream and impacting your systemic levels, then by what mechanism is it thickening your uterine lining?
Right.
And the studies we do have shown that the topical estradiol and estriol formulations do not create statistically significant increases in your blood levels of estrogen. Now, they were studied for 6 months, but we also know that estrogen is metabolized in a matter of hours, not a matter of days. So it's not like the levels keep on climbing. There's such thing
Hmm.
as a half life, right?
Yeah.
So I think that that is really the crux of the debate.
Okay. Well, and I know that there's all this, I mean, perimenopause is so hot right now, and vaginal estrogen also. I mean, all the menopause hormone therapy is, but especially vaginal estrogen seems to be somewhat controversial, and I don't get it. I don't understand why that's the case.
No, I think that needs to be over the counter. It's safe
Right.
for everyone, even women who are actively being treated for estrogen receptor positive breast cancer. Vaginal estrogen is a critical part of taking care of our bodies and ourselves as a woman that goes way beyond libido and sexual health, but protects us from chronic UTIs that can lead to urosepsis. Having taken care of patients in the hospital in residency who were dying from urosepsis, they were all women.
Hmm.
It's a terrible way to go. And it's preventable. And I think as women, we have been delivered this message over time as we walk through the feminine care aisle and we go from the tampons and the maxi pads to the adult incontinence pads, that
Yeah.
somehow this is just this natural progression that we're supposed to just accept, that we're going to go from bleeding to leaking. And that's not something that we need to be destined for. And vaginal estrogen is such a proven, effective, and safe way of
Well,
defending from that.
it's so easy, and like I use it, and I'm also started this pelvic floor therapy program because I refuse to be reliant on pads or diapers or whatever, either in a few years or later on down the line. I refuse that. Like, we all deserve a better life than that.
We deserve our dignity.
Right.
And we can, and it's the same thing. And one of my fantastic perimenopausal symptoms has been some more urgency, bladder urgency.
Yeah.
Well,
Like
vaginal
the key in the
estrogen.
door and you're just
Yes, it's
like,
the
I'm
key
not
in
going to
the
make it.
door.
Yeah.
Absolutely. And it's, vaginal estrogen helps with that. It won't be
Yeah.
the only thing that helps. There's pelvic floor physical therapy, which I'm a huge fan of and has really helped me. And there's some cognitive behavioral therapy that can help with this too, with just, I call it panic bladder
Yeah.
that we get sometimes. But addressing that as a woman is really helpful. And I think one of the reasons that I became so interested in estrogen on the face, beyond just what it could do to help my patients who were interested in it, is that in talking about it on their face, I'm prescribing more of it and I'm getting more and more women using it in their vaginal areas.
That's
And if
great.
that helps one woman not develop urosepsis and stay out of the diaper aisle, then it's a huge win. So
Yeah.
I prescribe it all day long.
Well, I love that. And I love the podcast episodes that you've done on it too, because I think for whatever reason, there's a lot of shame around this. And I think that the more and more we just openly talk about it, we realize how so many of us struggle with it too and kind of normalize it. And then we can start to like get help because we all deserve better.
Absolutely. And I think communication and being open is such the antidote to a lot of the shame that
Yeah,
we bring on ourselves as women as we
I agree.
age. We really internalize a lot of the blame and say, well, this is my fault. I haven't been mindful enough. I haven't been drinking enough. I drank too much caffeine. We think of reasons why it's our fault instead of looking at the physiology. And
Yeah,
when we can have that conversation and bring it out into the open, it really just makes that shame dissolve. And then we
I,
have
yeah.
agency.
Totally. I agree. So, in prep for this episode, I just put a poll out to my Instagram followers asking what they wanted to hear about. And there was a couple when it relates to perimenopause and aging. There were two things that I heard about most common, actually, which was crepey skin and itchy skin, especially itchy ears at like 2 a.m. Is there anything
Right.
we can do about either of those?
Absolutely. So it goes back to the biology, right?
Okay.
So the crepey skin is happening because it's dehydrated. This is why putting like an instant skin hyaluronic acid skin plumper serum makes your skin look so much smoother. It's just infusing it with water. So
Okay.
crepey skin is dehydrated skin. If your skin's look, it's like, have you ever been told that if you're thirsty, you're already dehydrated and
Yeah.
it's too late? Well, if your skin is starting to look crepey and flaky, your skin is dehydrated. And you
Okay.
can't hydrate it from the inside out. Hydration is important systemically, but you need to hydrate it externally. So we're losing our barrier repair. As we covered, we're losing hyaluronic acid. So we're losing its ability to retain moisture. We lose more through an impaired barrier, and we don't hang on to what we have through loss of hyaluronic acid. So crepey skin is mostly a skin barrier and hydration issue.
Hmm.
So you need to put the hydration back, like using a good hyaluronic acid and then good moisturizers with emollients in them. And then what was the other one you
The
mentioned?
itchy skin, but specifically itchy ears that
The
people don't
itchy
have
ears.
relief for. Yeah.
Okay, so the itchy ears are really interesting. The itchy ears are also related to your skin barrier in part as that skin becomes thinner and more dehydrated. But there's also a component of seborrheic dermatitis that has an uptick in perimenopause as we have this shift in estrogen and androgen balance. And that louder androgen hormone that's promoting more oil production and sebum production as well as a change in pH of your skin can allow these yeast to overgrow, particularly in very sebaceous areas like our external ear canal.
Huh.
And that can be very, very itchy. It's basically cradle cap, like you see in babies, that thick, waxy, greasy scale, but it's happening inside the ears.
Interesting.
Yeah. So it's treatable. It's treatable with, typically a little steroid and an oil vehicle is a nice way. They're made for ear application to treat seborrheic dermatitis. Using a dandruff shampoo on the scalp and to wash around the ears helps to also lower that yeast load. Those things can be helpful. I know there's a trend of pumping Flonase into the ears. I just
Oh,
want people to keep in mind that Flonase is a nasal product. It's alcohol based, and that alcohol could be very stingy and irritating to the ears, especially if it's already inflamed. And what feels good about that is a steroid. So if you're waking up at 3 a.m. or at any time of day having itchy ears, it's something that's typically very manageable with the help of your dermatologist.
oh my gosh, that's such good news because I have this women's group on Facebook and there have been several posts about that and people are just miserable. So, if like, how do you help patients? Because I know that we're not in the same state. Do you do like virtual consults?
So I do virtual skincare consults, really focusing on products to use, staying outside the medical space. It's limiting because of the whole you can't practice medicine outside of any state that you're licensed in, right?
Oh, okay.
So providing medical dermatology, I provide medical dermatology in person in the state of Georgia. I do skincare consultations though virtually. And those appointments are easily found on the website. The way I'm really trying to help reach is with my podcast with the Skin Pause. I
Yep.
just started a Substack a few days ago to publish on these topics through my social media and through conversations like this because I really do want to be able to reach people outside my four walls in Atlanta, Georgia.
Yeah, isn't it incredible? Like once you start creating content or podcast or whatever it is, you just realize how many more people you can actually reach.
And you realize how much of a need there is
Yeah,
for information and to be a voice in the room that's providing medically validated, evidence backed information to help guide people in the right direction.
that's awesome. Yeah, I'll make sure to put all those links that you mentioned down in the show notes so people can easily find it. One thing I want to ask before we close are what are the top like in-office treatments that you really love for people?
So I love aesthetic treatments that actually help the health of the skin. So I
Okay.
think about them as skin health treatments with a side effect of making your skin look better. And so one of my favorites is a biostimulatory injectable, PLLA, also known as Sculptra, because that really helps to restore contours to the face where they're supposed to be and integrity to the skin barrier rather than just something into the skin that changes its architecture. So I
Like
do,
Botox?
well, Botox is a little bit different. More,
Okay.
the second one I was mentioning was more of like a gel filler or something
Oh,
like
okay.
that. So I like something that more naturally rejuvenates and gives our skin back what it needs more of. So anything that gives it back more of its collagen or elastin, like a Sculptra injection, is helpful. I love lasers because lasers are going to help the texture and the smoothness and the tone of the skin. But fractionated lasers have also been shown to help reduce potential cancerous changes. And
Hmm.
so anything that will give a patient, get her looking like herself, but also have skin that's going to function in a healthier way over the long term is important to me.
So the injectable that you mentioned, I haven't heard of that. I need to learn more about that. But is that something that could help maybe the sagging skin or like the jowls that we start to get? I've even noticed here, it's getting a little
Yeah.
loose down there.
Yeah, and I will say that this jowl jaw area is usually kind of ground zero for female facial aging and
Okay.
what women complain about first. And so I think of it as the upward contributing portion that we can address and then the downward forces. So when we look upstream of the problem we're trying to address, it's usually from the bone loss in the midface,
Yeah.
muscle loss in the midface, and fat loss in the midface, which are all three things that we know happen with age. We lose bone, muscle, and fat. Fat where we want it. And
Yeah.
so restoring that volume along the natural original contours of your face with something like Sculptra and injecting it along the mid face or into the temple where we tend to get some hollowing over time, or we inject it laterally to give that lift. It's a nice way to restore the vectors of the skin without creating an artificial look.
Hmm.
And then we look downstream from the problem. And what happens is we have a very thin muscle that anchors in just above the jawline and it spreads down the neck and it's called your platysma. Well, your platysma muscle is a downward jaw muscle. It is pulling your lower face down. It's a lower face depressor. And so by treating that with neurotoxin, with small amounts of Botox that are appropriately placed, it reduces that pull down.
Hmm.
And so that can reduce the stretching downward effect of that force over time, and it can reduce the mechanical pull down over time. So we look upstream to the midfacial structure, and then we look downstream to the platysma band.
Oh, that's so awesome. It's nice to hear that there's treatments that aren't necessarily filler because I've been very hesitant with filler just because I've seen it go wrong. And it seems to be something that you just have to like keep doing over and over, and people don't look natural after a while, and I don't
Yeah,
think anyone wants that.
and fillers still do have a role. They have
Okay.
gotten a bad rap, and I think it has to do with the way they've been used to alter an appearance and develop features that are unnatural for
Hmm.
someone, like accentuated cheeks and that disruption of the eyelid cheek junction that looks terrible, and then the overly injected mouth. These things are not natural features on someone, but HA fillers do play a role. They do put more HA, hyaluronic acid,
Hmm.
into the skin, which can be hydrating if used appropriately, but they're not all in the right hands of people who are appropriately trained. And there are aesthetic consequences, and then there's true medical consequences when they're not done appropriately. I'd say in my practice, I have decreased my filler injection probably by about 80%.
Hmm.
I just don't do very much of it anymore. I, most of the time, am able to shift people over to something like a biostimulatory injectable or an energy based treatment that's going to really more naturally rejuvenate and restore what their skin is missing.
Okay. Wow. Well, thank you so much, Dr. Corrine, for your time today. We didn't even get into like lifestyle things like diet and stress and sleep and all that. Maybe I'll have to have you come back so we can talk about that stuff. But you
Yeah.
shared so much today, and I really appreciate your time.
Well, this was a lot of fun. I really enjoyed the conversation. Thank you for having me.
Yes, thank you. And I'll make sure to put your podcast link down in the show notes too. I've binged your episodes, it's great. And I encourage everyone to follow you online because you share a lot of evidence based information.
Well, thank you for that. I appreciate it.
All right. And thank you, everyone, for listening. We will see you next time.
Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.